Hello, everyone, and welcome back to another episode of the Root of the Science podcast with your girl and with an E. If you are new here, welcome to the show. It is such a pleasure to have new people tuned into this podcast episode. And if you are regular, thank you so much for returning. Always, always love it. Reminder that you can listen to this podcast wherever you listen to your podcast and also watch us on YouTube. Also, if you think there's somebody who we should be chatting to, please refer them to us either by sending a message on LinkedIn or Facebook or Instagram at The Root of the Science Pod, or you can search for us at The Root of the Science Podcast. Reminder that we also have weekly newsletters that come to you via MailChimp, or you can subscribe on LinkedIn. Science communication, especially in health, is crucial for fostering informed and resilient communities. In Africa, where public health challenges are prevalent, effective science communication helps bridge the gap between complex scientific knowledge and public understanding. It empowers people with the information needed to make informed health decisions, enhance public trust in science, and also drive policy changes. With the continent facing issues like infectious diseases, vaccine hesitancy, and health inequalities, there is a dire need for skilled science communicators who are essential in promoting public health, encouraging scientific literacy, and advocating for social justice. Today, we have Treezer Michelle Atieno on the show. She's a health and science journalist from Kenya, a correspondent at Science Africa, and our very own podcast producer, also our newsletter editor. I am so excited to have Treezer on the show and for her to be on the front of this camera. Treezer is a powerhouse in her field, and today she'll talk about her experience in science communication and the launch of the reporting project on polio eradication in Nigeria that'll be available throughout these couple of weeks. Let's go. Hello, Treezer. Welcome to the show.
Hi, Anne. How are you?
I'm so good. I'm so excited to have you on today. This is so special. You get to be the one who is behind the scenes, who is sourcing the guests, but here you are today, front and center. How do you feel?
First, thank you so much for having me on the show. I feel nervous. For the first time, I feel like the story is about me, and that is kind of also special because most of the time we journalists tell stories of other people and we are not allowed to even bring in our opinions. So this is good because today I am the story and I feel happy about it.
I'm so excited. Yeah, I think I also get this as well, where when you are interviewing or the one who is creating the story, you can't really put your personal touch on it because you have to have that level of disconnect so that the story becomes a story. But today you are the story. So let's start from the beginning. Why journalism? How did it all get here? Can you just start us on the journey of how you got into this journalism space, and specifically what inspired you to actually go into journalism?
Okay. So for journalism, I like writing more than anything else in journalism. So it started like this. When I was growing up, I was so conservative. I didn't like having so many friends. And so most of the time, when I had issues, when I was too happy, when I was too sad, I'd just take a book and write what happened. If someone wronged me or anything happened, I would write it down and say, on this date, so and so wronged me, say this. And I know it is a bad way to record things, but it helps. So I would write, so and so said this, I felt hurt, and I've looked at it, and this is what I've decided to do. And then I would write even the resolutions about it. And yeah, it helps me to deal with so many emotions.
Yeah.
Because I was somebody who would not talk really about. So when I was approaching somebody, if I had an issue, I first wrote it down, so I'd come to you and I've written it down and I've decided on what to do. So I'm coming to tell you, oh, so did this, I wrote it and I decided I'll do this. What do you think? So yeah, it was a coping mechanism for me.
Yeah.
writing. And I viewed it as very, very healthy. And so I wanted to do more of writing in my career, the career that I chose. And then why health? So my writing was good, but also I felt I needed to write and use my writing to impact people's lives.
Sure.
And then where I grew up in a slum. And in this slum, the hospitals, the government hospitals, were so far away. Actually, we had one, and it was far from where we stayed. And when you go to that hospital, you'd find a lot of people. So it would take so many hours for you to even get medical attention. So people relied on private hospitals that were again very, very expensive.
Okay.
So I saw this as a form of inequality in the way people access health services.
Yeah.
And I said, growing up, I want to write more, use my writing to impact people's lives. And I'm particularly interested in health because so far I wanted to find out what has been done about situations like this, about what is the government and many stakeholders doing to ensure people access health, especially solutions in health, and they're readily available and they're affordable for everyone in the country. So that is why I grew up loving health. And
Oh, fantastic.
my journey into,
Okay, so thank you for just giving us that overview of how you actually got here. Now, you said that, you had a personal story of why you chose health and science. But, whenever we think of sciences, it seems like this very complicated thing, even speaking in health. When a doctor talks to you, we say their writing is weird, or even just some of the terms. So as a health reporter, then, if you want to have stories that reach the general public, the people who are actually affected by these problems, what are some of the key strategies that you actually use to communicate your health and science stories effectively?
Yes. Thank you, Anne, for the question. So it is true that health is hard, science is hard to understand, even for us that communicate it. So there are so many techniques that that we use as science and health communicators to ensure that people understand what we are talking about. Because at the end of the day, it's about communication. It's not about the words you use. It's not about how good you can put it. It is, are you talking to somebody? So one of the key strategies in communicating health is storytelling. Let me tell you an example. Let me give you an example of a story that I did and how storytelling can actually change how we understand something. So I was doing a story on gender-based violence, and it was a story on how COVID-19 had helped to strengthen responses for gender-based violence. So one angle I could have used to tell this story was just saying during COVID-19 there were these recorded cases of gender-based violence, and the response was too low. And then there's a time safe houses were set up, and then I would give all the jargons and talk about gender-based violence is this and this and this, and then I finish it. Yeah, that is one angle of looking at that story. The second angle of looking at that story is actually interviewing someone, but I report it without allowing this person to speak, without putting the direct quotes. So I'd interview somebody and say, in this village, so and so, in the month of in this year, so and so did this, and the child did this, and the mother did this, and I would give that story. That is a second way of telling the story. And then there's a third way of telling the story of you interview this person who is a victim of gender-based violence. Yeah. And you allow them to tell their own story. So what you do is take this person as your character. And then what you do as a communicator, you give background information, that is the setting of a place, of a time. And then you bring in this person to actually tell the story. So the person comes in and says, it was in the evening. I left my child here, and then I received a call, and then this happened. So the best way to tell that story would be introduce the story, but allow this person to bring in, to talk about what really happened. So that way, if you allow this person to talk about it, of course, people will relate to it more because one, you have humanized it and you've allowed the victim to tell the story the way they want to tell it, the way they want it to appear. So what you do after you give these people time to talk about their stories, and of course, you have to do the relating the stories. Your work is now to just connect them and give information here and there. And then at the end of this story, now is when you bring in all the background information, gender-based violence in this region happens like this and like this. So that before somebody gets to that last part with so many sciences and so many background information, the person has already understood what happened and has the entire story. So the person can even choose not to read the background information at the end, but it will be, you shall have communicated very easily. So that is an example of how you can use storytelling. Another thing is using infographics. So there are a lot of data in health and science communication. So and usually you do not want to leave the data out because they make the story make sense. So what you do, you can visualize some of this data so that instead of saying in 2021, 2 million people died of TB. So you bring in the aspects of one person in a day. Each day, 3 people die of TB. It is relatable. And then once you do that, you can have your chart, you can have your pie chart, you can have your floral chart, you can have your graph to now visualize this data so that the person doesn't have to know the exact numbers, but they can see that actually in 2021 it was high, in 2022 it was higher, in 2021, 2023 it dropped. And so something like that so that people get to understand. Again, when you're talking about there are stages, sometimes there are stages in health. So maybe you're talking about a disease, and then there are stages that this disease takes, how it affects people. You can be stage 1. So it is important to also visualize something like that so that people like pictures. People like pictures, people like colors. So because of the colors you shall have used, somebody will be interested, will understand more, will stay in that picture to just zoom it and say, oh, so this is what happens. So that is another way of communicating health and science. But despite using all that, you still have to give the terms you can't replace, the terms in health and science that you really can't replace with anything else. So that is why all these techniques will help somebody to understand, but at the end of the day, there are terms you have to write the way they are. So yes, thank you.
No, definitely. I think as a science communicator, we can both agree that we use these wonderful techniques that you have already described. But what matters also at the end of the day is the important terms, because we want to be able to communicate effectively, but still putting the important stuff. So it's great that you've got these types of communication strategies. Further, I just wanted to check. So when you communicate, what type of audience do you usually communicate to? Because I know with science communication, that varies. So what is your general audience when you're writing a piece of a story? Does it change depending on what you're writing on? Or do you have a type of community that you are always targeting?
Can you just repeat the question?
Okay. So what I wanted to say was that you spoke of the different types of strategies, right? That you've been using to communicate. So I wanted to know, do these strategies change depending on on an audience, or do you have a general audience who you typically think of when you're communicating your various health and science stories?
Okay. So when I communicate the science and health, so I am usually communicating to a particular audience, and I do the stories in a way that everybody that I'm targeting is able to understand. So the first people I communicate to is the general public, because the story is about them.
Yeah.
They have to understand the story. So people have to learn from what happens in our places. And mostly I communicate solutions in health. So when you're communicating solutions in health, you want people to learn about the solution, to know where they can find it, to know how it works, to know how much it costs, to know how it is beneficial to them. So it is the general public. Again, when you're communicating health and science, you want people in the government to look at these stories. Probably they have not invested enough in the solutions that you're talking about. So, and in solutions communication, at the end, of course, you have to highlight the challenges that this solution is experiencing and things that are needed to upscale it. So you are also communicating to the government to see if the solution needs more funding, needs more investment so that it can get to the people. So again, you're communicating to policymakers. If you leave the government, you're communicating to policymakers. You are trying to highlight different challenges in health as much as we are providing solutions. What is missing in this? What is missing in this? What can be done? And all that. So I communicate to a lot of different types of audiences at the same time. So that is why it is important that every time I write, I try to use these techniques that enable science to be understandable, so that the general public, any other person can understand this, so that a doctor reading this can relate, because it is from the expert opinion, and also so that the government, the policymakers, and every other person doing research in health is able to read and understand it. That is why I said that when for example, I write a story and then I'm done with the storytelling part, then at the end, I must bring in now the real information, the way it is, the data, the hard data, and all those things, all those a wide range of background information on the topic, so that if somebody is reading this and they're comfortable with adding it at the storytelling part where the storytelling ends, it's okay. They still understand what was said. And then if somebody wants to understand this more, if it is a policymaker, if it is an expert, if it is, so they can get to the background information and still get to understand what is going on. So most of the time I try so much to incorporate all these strategies so that I make sure that all my audiences are taken care of the student.
Fantastic. So, Treezer, thank you for that. So, your work, you've been doing this for a couple of years, and your work has been recognized for different fellowships and and you've been awarded different grants. So firstly, congratulations. Clearly you're doing something right. So I wanted to touch on that. What is one grant or one fellowship or project rather, and story that you've done that you are the most proud of and it's really fresh in your memory that you'd love to share with us?
Okay. So I'll talk about a project and then I'll talk about a story. So the story is not in the project.
Okay.
So so one project I'm really happy I took part in was a project that I did with Code for Africa. And that I did with Code for Africa. And it was on a Feed Shield tool. The Feed Shield tool is a tool that helps somebody to detect trolling on Twitter and also protect themselves from trolls. And also, if you're seeking an investigation on who is trolling you, you can actually get in touch and then investigations will be conducted. And then you'd get to understand the people behind the trolls.
Yeah.
So I'm happy I took part. It was Code for Africa and Jigsaw. So I'm happy I took part in this project because as I've told you, and for a long time, I had been talking about people's stories.
Yeah.
And one time I did a story, and then it was published on Science Africa. And then after it is published, because it is digital, it has to be shared on social media pages. So the story got to Twitter. And then usually when you're doing a story as a journalist, you have to remain very, very objective, very objective. And if somebody gives you information that does not make sense and they cannot substantiate it, you cannot include it in the story because all you want to do is communicate, and you have to confirm that what you're saying is factual.
Yeah.
Yes. So I got this information. I wasn't so sure because the person gave me this information and I tried to confirm it from the other people I interviewed in the story, and nobody could actually make this look factual. So I did not include it. So the story was on Twitter, and then somebody sees it and then says, "No, you did not include this." And then it was an issue, and I felt attacked because I could not have communicated something that I wasn't sure was true. So I felt so bad because the person commented and there were other comments. And things like this happen and you're like, so what is this? And then it was so bad. I felt bad. So I was happy to have been part of this program because for the first time, it was a program that was taking care of me as a journalist on the attacks I might receive on social media, especially on Twitter, and how I can protect myself from this. And I was also to reach out to several journalists. So I reached out to several female journalists who had experienced this, and I was talking about, I have tried this tool and this is how you can use it, and it is actually good because So I was happy to have been part of that. It was the me part. And then one story I am also very, very proud of is a story I did this year on AI ultrasounds. So that story, I did it. And then one day I'm scrolling through. Usually after I do a story, I also read it. And then sometimes randomly I go and do a search. And then I'm just searching. I just type AI ultrasound. And then I want to see if my name appears on the web.
That's clever.
So I was doing that, and I just searched AI ultrasound. And then when I searched that, things popped up. And one of the things that popped up was there's an international organization, Solutions Journalism Initiative. Yeah, it's called Solutions Journalism Initiative. And then I find my story featured on the Solutions Journalism Tracker. That story. And I'm like, what? And so I open it and I read it. And then it's there. They've given a background, and they've said you can read the full story on Science Africa. And then my name is there in my profile. And I was like, oh my. So yes, I was so happy about that. And several other things that have happened, so much grants and support and mentorship. So yes. Thank you.
Fantastic. I love seeing you get excited. And I think that's what you want your story to do, right? To when you've put a lot of care and a lot of effort in creating a story that hopefully touches people, and then you see it that it gets spread out to the world. And then it's like, yes, this is it. And I'm sure it motivates you to do more. So speaking of stories and more grants, you are currently a fellow for the United Nations Foundation Polio Press. You are a fellow there. So as we're doing this podcast, we're doing it as an introduction for the polio series that we're going to be doing on this podcast later on in the weeks to come. So can you tell us more about this fellowship and what can we expect? I'm excited because of course I've got to see the behind the scenes, but for the listeners here, tell them the context and also just like what are we getting excited about?
Okay. Thank you, Anne. So I am a United Nations Foundation Polio Press Fellow, as you have said. And the fellowship is about journalists traveling to countries that have experienced high rates of polio and reporting on some of the strategies that these countries have been using to eradicate polio. So, as a fellow, I am reporting from Nigeria. So, and some of the things that I'll be doing, some of the stories that are in the works currently is looking at some of the strategies that Nigeria and different partners, different health partners, have used to eradicate polio. Because in 2020, Nigeria was declared wild polio free. But a year after that, that is in 2021, there's another type of polio that came in, which is vaccine-derived polio. So, which is if you vaccinate people and you don't vaccinate others, when others are vaccinated and others are not vaccinated. So because you have introduced polio in some people, because the vaccine, you introduce polio into the child so that the child develops the immunity against the disease. So if you vaccinate other people and other people are not vaccinated, it means the polio has been introduced into the environment. So the people that are not vaccinated or are not under routine immunization system are at risk of getting the polio vaccine. But I think that is not my part. That is the part of an expert. So this type of polio is currently in Nigeria. And so we are looking at what are they doing to eradicate this type of polio, even after succeeding in eradicating the wild polio. So one of the things I'm looking at is the contribution of women. What have women done? What are women doing to help in routine immunization? Because now the thing now is routine immunization. Children have to be vaccinated, and all of them at the same time and continuously. So the role of women, community volunteers, and there are women also in the health system. We have doctors, we have researchers, we have immunization officers at every stage. So I'm looking at the lives of these women. What are they contributing in this fight? How important are they in the eradication process? And another thing I'm looking at is some key strategies that have been put in place. And one of them is the cold chain maintenance strategy. So the cold chain just means how to ensure that the vaccines are under good temperature and they are all potent, so that even as the children are vaccinated, no vaccines are lost, no vaccines get spoiled. So I'm also looking at the cold chain, what are the strategies, and some of them because there are areas in Nigeria that there's no electricity. So and vaccines still have to get to those areas. So how are they getting to those areas? So one of them is the cold chain. Another strategy is the liaising with traditional and religious leaders to ensure that there is acceptance of the vaccine, because these leaders are very key in how people take information, especially of health in northern Nigeria. So people rely on their leaders to confirm this is safe, this is not safe, we can do this, we cannot do this. So how important is it to liaise with these people to ensure that this vaccine is accepted and that everybody is immunized? So those are the angles I'm looking at. And in terms of what to expect, we'll have 2 written stories with pictures, with infographics, and with short videos. That is 2 stories, and then we'll have 2 podcast episodes. And one of them has a part 1 and a part 2, and then there's the second one. So those are the things to expect. And I'm also very excited about this project. And it's taken a lot of energy, a lot of work, a lot of collaboration, a lot of support. And I'm happy that it looks like in July, we are going to release all these stories. So yes, I'm happy about it too.
Exciting times. And also I'm just, as a person who's been watching you from the sidelines, very proud of the work that you've done. polio when you told me this, and I'm sure somebody might be like, why are they doing a whole polio thing? So I really like the fact that you explained that there's a new version of the virus that's come about, particularly in Nigeria. Speaking of Nigeria, you from Kenya, Treezer, and you had to travel to Nigeria to report on this. So now I want you to talk us through, because this is also some of the things that people don't get to hear. You just see the story and you see, wow, all this amazing stuff that you've done. So now I want you to take us behind the scenes. What were some of the challenges and opportunities that you encountered while reporting the story? Just take us through on some of those things so that people can really understand like the amount of work and the amount of things that happen before they see this final product in July.
Okay. Thank you so much, Anne. So the trip was very, very good. I enjoyed the trip. And there were good things, and there were things I needed to adjust to fit into what I needed to do.
Yeah.
So the first thing is that my travel took so long, over 12 hours to Nigeria, and I got there tired, and I had lost one day because it was I was to start on Monday and finish on Saturday, and then now I was to arrive on Sunday. And then now my trip I have issues with my flight, and then I get there on Monday instead of Sunday. And then I'm so tired, I can't start looking for people to interview, so I have to rest.
Yeah.
So one day is lost. And then I get there, and I was excited because I thought I'd enjoy the food, and I said, oh, I'm going to enjoy a lot of food. And my mind was telling me, I'm going to eat their catfish. So I'm there saying, oh, I must eat their catfish soup. So when I get after resting, I wake up and I'm like, I'm looking for catfish. Anywhere I get catfish. So and I tell them, do you have catfish soup? They say, yes, we have it. Okay. And then they bring the catfish soup. And then a lot of pepper.
Pepe.
Do you have one without pepper? And they're like, no.
This is it, Pepe.
This is how we do it. And and I had to eat that. And believe me, I tell you, I had tears in my eyes, and my chest was so hot.
Oh my goodness!
And my stomach was hurting, and oh God! And it was the first day, and then I forget to wash my hands properly because the pepper we are used to is so little. You can wash it off easily.
Yeah.
So I wash my hands, and I'm like, I think I'm fine now. And then accidentally, I touched my eyes.
Oh, Treezer! Oh my goodness! What an experience!
Yeah, and then so at night, I want to sleep. I want this pain to go away. I want to concentrate and plan for Tuesday's interviews. And I'm like,
goodness.
Oh my God! But that was that was just the beginning of it.
Yeah.
Because the thing is, there was no food without
Pepe.
Yes. So I had to get used to that. And eventually I did. And then another thing is the first day I do my interview. And then the second I do my interviews, I had around 6 the first day. So it's on and off. And then the second day, I'm supposed to meet a king. And then I thought we saw these things. I thought these things only appear on movies. And so I have to meet a king. They called their kings Serkin. So from the Jiwa community, so it was Serkin Jiwa. So I have to meet Serkin Jiwa. And then I'm told, okay, so if you're meeting a king, you need to dress in African attire. And you need to cover your head, everything, so that you don't expose any part of your body. So it is an African attire, also very long, cover all your hands and your legs and cover your head. I'm like, oh my God. So, and I realized I need to get a dress that fits, that is both African, and I only carried official wear.
Oh my goodness.
So we quickly improvised that.
Yeah.
Improvise that. And then the next day, I'm all dressed. I'm feeling uncomfortable because especially the covering of the hair part. And I'm feeling so uncomfortable. And I get there and you get the interview done successfully. But when you get there, there are a lot of protocols. When you see a king, the first thing you do, you are on your knees. So you don't have to face him while standing. So you get through the door and you're already kneeling. So some things like those. But it was an enjoyable experience. And then I have from now Abuja, I have to travel to Kano, which is now the real northern Nigeria part. And then again in Kano, I have to dress completely like a Muslim. So that, of course, there's that acceptance.
Yeah.
You don't want to be very different, and you want people to give you information freely without feeling like, no, you're not part of us. So it's so hot in Kano, very hot. And I'm like, no, this is so hot. And again, you have to dress like a Muslim and cover everything. And I was covering my hair, and I got to my first interview, and the lady said, no, but you don't have a hijab. And now again, I have to get a hijab and put it on my hair again, apart from the cover, the covering of the hair. I put, oh my God. And then, but it was a nice experience. And I was happy. Yeah, I was happy. One of the people I was interviewing was actually a former journalist. And then Dr. Eunice, she's called Dr. Eunice Damisa. And then Dr. Eunice Damisa tells me how she got into polio eradication. And she tells me, I was a journalist like you. And she says, how many years have you worked as a journalist? And I tell her, and she's like, oh, but you're traveling too early. No, you started traveling too early. So, and those are some of the good experiences, but the country was good. I got in touch with so many people, and we talked about a lot of things apart from the stories, other life issues. And I'm happy it went successfully and the stories will be out.
Yeah. No, that's amazing. You made me laugh. It was such a one. I think that's the beauty of traveling, right? That it's not just about the work, but you have to get into the culture, into the food, and your horizons expand. And what a beautiful place to start your traveling journey than Nigeria, because you see so many different things. And now you know for future. And I think it's really taught you for future that when you go to a different country, you have to understand the cultural politics, the culture, the politics, everything, because especially as a journalist, you, like you rightfully said, you don't want to be seen as someone who is completely different. So like you rightfully said, apart from all of these behind the scenes, the stories will be coming out to this July. So how do you think then these stories that you've done, this work, this fellowship, can actually influence public or policy spaces in terms of the health aspect, rather?
So one thing I liked about the Nigerian polio eradication story is that it is so organized. The structure is so clear. It is very organized. And also there is this part that they have done about establishing an emergency operation center for polio, so that when the works for polio needs to be done, it doesn't have to go through a lot of, can you approve this? Can you approve this? Can you approve this? So the emergency center is where all the government officials and all the partners from WHO, from UNICEF, from any other person, CGPP, from all these other parts, they sit in the polio emergency operations center. So that when something needs to be done, it doesn't have to be the government must approve this. The government. So it is operating as an independent health, a part of health, but very independent from every other thing, so that people can act very fast. So I liked that structure because, again, when you look at their monitoring systems about what happened. They're tracking their progress, about looking at what the vaccines given or not. There are a lot of structures. You'd think it's a military system because a lot of accountability, but it is very, very effective. And I got to learn that even during COVID-19, when COVID-19 came, actually the system for polio eradication was what was used during COVID-19. And even when Ebola came in Nigeria, that was the same system that was used. And it was effective. And in a short time, things were in control. So I like it. I like that bit of the polio eradication part. And I think telling this story, talking about how these people have structured this system, will really help other countries to understand how they can also adapt, they can also adopt this kind of system and use it in some of the health challenges that we experience in Africa, so that they can benchmark, they can look at what works for different countries. And of course, it is a very good system that I believe is able to, if adopted, is able to help solve some of the very pressing health challenges that we have in Africa. Another thing, again, we are looking at the strategies, individual strategies, like how is it important to support women in healthcare system? Why is it important? What do they contribute? So again, this one will also enable different countries to also learn some of the key priorities to put into place when dealing with health challenges, and also looking at how can they invest more in women in healthcare, how can they invest more in collaborations with the different leaders, with different sectors, civil organizations, so that things are done. So I believe it is a very good system. I believe if it gets to the right people, as we want it to, it is going to really change the healthcare space, because there are a lot of lessons to be learned from the polio eradication stories. Thank you.
Fantastic. I like what you said, that it can be used as a benchmark, as an example for so many other things. And I hope that, putting awareness to this program, one that I personally didn't know until, you started working on this, can really shine a light. And so many people can learn from this. So, Treezer, as we are getting near the end of this interview, I want us to go back to you, right? Looking ahead, what are your future goals in terms of you being in this journalism space? Are there specific stories that you are aspiring to cover, different places that you want to visit? Tell us more in terms of where you see yourself in a few years from now.
Okay. So I'm already a global health communicator, and I want to do a lot more of global health stories. I want to be able to travel to many countries, do stories about what challenges they're experiencing in health, what solutions they have, so that I create that space where Africans can learn about African solutions and what these other countries, what we can pick from them. And also I would like to really collaborate more with other international journalists, so that, of course, to get that mentorship, to also grow. And also I want to travel a lot. And I have a list. Yeah. And I have a list of many countries I'd like to visit and do stories from. And yes, Anne, and at the end of the day, I really want to be a champion of global health equity, so that I illuminate these solutions in health in Africa. And I also talk to government and policymakers and try to convince everyone to invest in health solutions that are important for us as Africans, and also to get people to read these stories, to learn about these solutions, and also to advocate for everyone to be able to access these solutions, because it will be pointless to be a global health communicator if your communication is not actually important to that person who needs that solution. So yes, that is where I want to be, Anne.
Inspiring. And by God's grace, I'm sure you'll get there. You've already started. The rest is coming. And I cannot wait to see you do all of these amazing things because you are very passionate about what you do. And honestly, one of the hardest working people I know. And I'm excited for what the future holds for you. So, Treezer, the final question. You have given us an overview of your journey and even now some of this really inspiring work that you've done working for the United Nations. That's as a fellow, I mean, being part of that fellowship is huge. So if somebody's listening to this and is inspired by you, what advice would you give them in terms of, being in this science and health journalism space, particularly if they also want to make an impact in their world like you are doing right now?
Okay. So when you do a course in journalism, usually in Kenya, in most of our universities, there's no part where you're told you can specialize and become a health journalist. You can specialize and become so there's no structure for specialization in journalism. So you do journalism as a course, generally like that, and then it's up to you to get out and decide on what you're passionate about and the path you can take. So one of the things in health and science communication is passion. Do you want to do it?
Sure.
Because nobody has taught you how to do it. Most probably nobody has taught you how to be a health journalist. You are just a journalist. So are you passionate? Are you sure this is the path you want to take? And if you have analyzed yourself and it is your passion, yes, well and good. But again, when you get to that space, remember your background has nothing to do with health.
Yeah.
So again, it needs a lot of hard work, and because you have to read a lot, because some of the mistakes you can't afford to make while communicating about health and science is to also misinform. And you have to keen even when you're talking, you have to be very keen even when you're talking to people about science. They give you information. And remember this information, this is not your field. It is up to you to actually fact check every bit of it so that you are sure the information this person gave you is not false, so that you also don't contribute to the misinformation going around about health and science. So it needs a lot of hard work. This is the only field where you have not done health, you have not done science, but you have to understand health. You have to understand science to be able to communicate. So usually when you're doing something about a disease, let's say, for example, we give the maternal health example. So when you want to talk about maternal health, do you know it? Have you read about it? Have you read all the angles about it? If somebody is talking to you, are you even able to counter the questions and ask the next question because you have some idea of what you're talking about? So it takes a lot of time to read and to learn, to also it's very essential to look for training opportunities. Usually there are a lot of training opportunities. Online. Some are free, some are paid, some come in terms of fellowships. So you have to find the free ones because you have to start from somewhere. So yes, you have to look for the free ones and go through all of them, read, do the test if the tests are there, get your certifications. You have to, the paid ones, if you can afford them, you have to pay and also get the trainings on how to report on different parts of health, different aspects of health, communicating it in a setting in Africa. That is also a course, communicating this particular disease and this disease, communicating the solutions, communicating the justice issues in health, every type, different types of things in science. So again, it is important to always be on the lookout for fellowships, because most fellowships come also with mentorship. So if you're lucky and you get a fellowship, you get the training, you might get support to do a story, one or two, and also you might get an opportunity to be mentored by people who are already in this field. So these people will tell you, no, I have been here, These are the challenges. These people might even refer you to more other courses, more opportunities that you can explore as a health and science journalist. So I will not say it is easy. It is not, because it takes a lot.
Yeah.
It takes a lot of work. But you have to go all out, decide it is what you want to do, and be there for it, no matter what. Yeah.
Fantastic. Thank you, Treezer. And you're right. It's not easy, but it's worth it. And the passion is important, but the hard work is even more important, because passion can only get you so far, but hard work really makes you last. Thank you for coming onto the show, for coming behind the camera, and rather coming from behind the camera to the front. I hope everybody's excited, because for the month of July, you'll be seeing a lot more of your face. We are going to be co-hosting together, and it's such an honor to do that. Thank you for inviting me on. Had a wonderful time also learning about this really, really important work. So again, proud of you, and thank you for coming onto the show.
Thank you. Thank you so much, Anne, for having me on the show, on the camera. So I am so happy, because again, you are one of my mentors in this project. And for the first time, I am co-hosting a podcast.
Yay!
A podcast episode. So yeah. Thank you. Thank you so much. And I'm happy to have been in the show today. Thank you.
Great. And to everybody else who's tuned in, thank you for listening and watching an episode. We look forward to seeing you next time. Goodbye.